We have seen that there are differences in post-stroke outcomes, specifically in like independence after stroke and mental health outcomes, depending on the socioeconomic circumstances where people live. And we have seen that people living in the most deprived areas are getting worse outcomes at 1 year and at 5 years after stroke. So we wanted to investigate what was like the causal mechanism of these differences. So for doing that, we did some modeling on like the trajectories to see if it was like access to rehabilitation or access to acute care or access to secondary prevention that was driving these inequalities. And what we found was that all these inequalities at 3 months, 1 year, and 5 years were all driven by cardiovascular risk factors mostly. So hypertension, diabetes, AF, like all these together were explaining the majority of these inequalities. And things like care that receives a lot of attention, like a lot of investment, it only modifies these inequalities a bit. So we're not saying these are not important, it's just that we need an equality framework to address like these interventions.